Hello, this is Dr Helen and Welcome to our GenderGP podcast, where we will be discussing some of the issues affecting the trans and non-binary community in the world today, together with my co-host, Marianne Oakes, a trans woman herself, and our head of therapies. Welcome everybody to this edition of our podcast. I'm here with Marianne as usual, and we have a lovely guest today as well. I'd like to welcome Alex, who I think is very exciting because her speciality is virtual facial feminization. I love the fact that it's facial feminization because that's going to help a lot of people, but also the fact that this virtual thing, which is very much what GenderGP is all about. So Alex, let me allow you to introduce yourself and tell us all that you do. Take the floor.
Right. Do you know, it's really difficult because I have one of those jobs that doesn't have like a proper name. People say, what do you do? And then depending on how much time I've got, the answer can be very long or very short. But anyway, I'm Alexandra Hamer. And so I advise people on facial feminization surgery. I'm not a surgeon, I'm not a doctor, so it's not that I advise them on the surgery, but I explain what makes their face masculine and what techniques there are available that can, feminize it. And I also simulate the changes in Photoshop so they can get a sense of how those different procedures will look in real life. And then by doing that, they get a sense of what's important and what isn't important. The thing is, if you go to a surgeon, they will often give you a very, very long shopping list of procedures. And a lot of those often will make very, very little difference, but will cost you thousands and thousands of pounds. And so I can show people, I can say, look, your forehead makes a huge difference. The chin makes a very tiny difference. So if you're on a budget, So yeah, that's essentially what I do. I don't know, does that explain it?
Yeah, it does. I think it does to me. I suppose the question in my mind is, what are key skills needed to do your job, if that's not too big a question?
The key thing is that I have been studying facial gender differences since 2002, so for about 18 years. And that's really the key. Skill's not the word; it's the key knowledge, if you like. And I've done some original research in this area, pointed out a few things that people hadn't spotted before, and things like that. So the key skill is being able to identify facial masculinities, and then you need a little bit of background knowledge of the surgical techniques available.
It's always, isn't it? It's the case with as we see time and time again, is that it's such a minefield. People don't know where to go to get information, and if you're just kind of surfing the internet, it's impossible sometimes to put it all together. And like you say, there is that massive shopping list, and people don't know what's going to suit them, do they? And what is actually right for them. So it's really exciting to be able to do what you do. How does it work? How does, like, if someone came to you, how would the process work? What would you do? How does it go?
Well, essentially, if I'm working, because I also work with facial team. If I work with facial team, it's a different thing. But if they're coming to me through my website, what happens is I have a lot of instructions on my website about how to take the pictures properly. Because that's point number one, is that just as a basic thing, you need the camera to be at least 6 feet away, because otherwise you get this thing called barrel distortion, right? Which makes your nose look big, makes your lip to nose distance look longer. So people are taking pictures with their phones and thinking, oh, this is a problem, this is a problem. But no, you can't see it properly unless you get 6 feet away. So there's instructions on taking the pictures. They email the pictures to me. They answer several questions. Are they on hormones? Have they been on hormones for a while? Because that affects the facial features to some extent. Things like age, weight is an issue as well, because we store a lot of weight around their jaw area, and sometimes it's difficult to tell whether somebody is a little bit overweight or they have quite a heavy bone structure to the jaw. So, you know, so there's a load of questions they fill in. And then I usually work on 3 pictures, a frontal, a three-quarter, and a profile. And I start analysing, and I write them a full written assessment, going through each feature one at a time, explaining what's masculine and what can be done about it, and usually simulate the changes one at a time, so that they'll get several versions of each picture. So, for example, they'll get a picture with just showing the forehead changes, then one showing forehead and nose, then one showing forehead, nose, and chin, so on and so forth. And but it's also a case of spotting what I know some surgeons are going to recommend, even if you don't need them. And so I sometimes simulate that, even if just to show that it's not going to make any difference. So that's essentially the process. And then I email the pictures and the assessment back to them a few weeks later when I've done it.
So it must be really exciting, I guess, to kind of, you know, have the before and after as a picture. I can imagine that's a really exciting time.
For me, it's very stressful. Stressful for me because I know how important it is, and I know that there are people making decisions based on what I show them. And what that means is that I have to get it right every single time. It has to be. I always have to do my best work. I can't ever just say, oh, that'll do. So every single time I do a picture, it has to be my best work, and that's quite stressful. But the impact on the patients can be very profound, and I see this when we're doing live consultations like we were in London. You know, the surgeons are typically talking to the patient for 20, 30 minutes whilst I'm working on the pictures. And the conversation is very academic. It's very, oh, well, you would benefit from brow bossing reduction and so on and so forth. And this will have a, you know, it's a conversation about something. But when you actually see it, that's when people tend to get quite emotional. And we've had some quite profound moments really during consultations. I mean, it's the oldest cliche, isn't it, that a picture speaks 1,000 words, but you know, it's really important to be able to see.
Yeah. Because
you're doing something with your face that people are going to see and that you're going to see. It's a visual thing, and explaining that brow bossing makes your face look masculine is different to seeing that it makes your face look masculine. So it's that can be very, very satisfying.
I think what you just said there about how it's very exacting what you do, isn't it?
Yeah.
One of the luxuries that we have with hormones, I suppose, is nobody really knows quite what they will and won't do to an individual. So we can only explain the limitations, I suppose, and potential benefits. But where you're talking, it is quite an exacting outcome, or am I misunderstanding?
Well, it's what I like to what I say to people is that it's not a prediction as such. It's a bit like having an architect in to help you design a house, and it's very, very useful. They can show you a picture, and immediately you say, well, no, for a start, I want the front door in the middle of the house, and I want, you know, this, and this, and I want this kind of roof. So then they sketch it again, and you say, yes, that's much more like it. And now can you do the door red? And can you do this kind of fence? Blah, 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 blah. And then eventually you get to a thing, yes, this is what I want, build me that. Now, the day you come to you visit your finished house for the first time, it's not exactly like the drawing. You know, it's like you might say things like, "Wow, it's bigger than I imagined," or it's you know, it's grander, or it's smaller, but you have established the principles. It's basically it's what you wanted, and by sketching it out beforehand, you could see what was important to you and what wasn't important to you, and what was going to make the difference. And you know, does that agree?
Yeah. Perfectly, actually, yes.
So it's more of it gives you a target. I mean, typically, for example, I don't know, let's take a chin, for example. Now, the difference between a masculine chin and a feminine chin is that a masculine chin essentially has a square shape and a feminine chin has a rounded shape. So what I can simulate is the change from a square shape to a rounded shape. Now, in real life, it might come out a little bit more pointed or a little bit more rounded, or it'll be a tiny bit wider or a tiny bit narrower. But what you establish with the pictures is that by removing the squareness, it has you get a sense of how feminizing that is for your face, or not, if you know what I mean. So, these things vary, of course, according to what surgeon you go to, and there is always an unpredictable element with surgery, because people heal in different ways, and there's certain things. I mean, when I'm working with facial team, I get the CT scan as well, so I can see the underlying structure, which helps. But a lot of the time there are certain unpredictable elements.
So that's interesting. So with the facial team in Marbella, we did a podcast with them on a different episode, and we have some more coming up. So it's going to be a really good kind of series to put together. But they are a group of surgeons in Marbella who specialise in nothing else but facial feminization surgery.
Yeah.
And so it's interesting, isn't it, so that you get the luxury with that of having the photograph of somebody 6 feet away, and then the CT scan, which shows the bone structure underneath the skin. So like take all the skin off and let's have a look at the bone structure, and then compare that with the actual photograph. And then you've got the Photoshop, which says, right, I reckon, looking at this, that you probably, feminizing your chin, for example, is going to look something like this. And basically, it's going to cost you something like this. Do you think it's worth it? I guess that's kind of thing. I'm feeling a little bit sorry for the surgeons, actually, because it's a difficult job, isn't it? I've worked with many, many surgeons, and we always used to joke that, there's a particular type of person who becomes a surgeon, and a particular kind of person who becomes a physician or a GP. As a doctor, you're guided into a particular kind of job, and I think, I'm not the kind of person who could ever have been a surgeon, but if I had been that kind of person, I would have really valued someone like you who kind of can do the you mentioned the artistic bit, but it is that kind of artistic, fluffy, nice, soft bit which really explains things really well. It reminds me a bit like a specialist nurse who works very closely with a surgeon. The surgeon does the surgery, and that's what they're very good at, and that's what they're trained at. And the nurse is the kind of complementary to that procedure, and this is what it's reminding me of, really.
Yeah, I suppose. Yeah, it's that surgeons are often of a type, aren't they? Actually, I have to say that the guys at facial team are not that type, really. A lot of surgeons you find are quite. This is probably the wrong word, but a little bit psychopathic, shall we say?
You said it, not me.
There's a certain coldness there, but. One of the things I liked when I met the facial team guys was that they were kind of normal. And I thought, well, this is a refreshing change. Yeah. And but also one of the key things when they suggested we might be able to work together was that I specified that it has to be that they don't tell me what to do, that I'm employed as a second opinion, as well as anything else. And what I liked about them is that they embraced that, so that in a consultation, now I can't say anything about surgical technique. I can't say what kind of sutures to use or anything like that. I know nothing about that. But what I can say is I can mention something that I think might be useful that the surgeon not necessarily hasn't spotted, but maybe hasn't considered, or that they might suggest one thing and I might say, well, that would work, but then you've got to balance it with the width of the jaw, and so let's try some sketches here. So it's kind of a conversation, and they're very happy for me to give my input, and so that's very important to me, because then I know that there's no kind of coercing the patient. Yeah, and I'm not just being told, that they're not. See, this is the other reason I like working with them, is that they don't do these long lists of procedures. They start with this same principle that I do, which is, what's the minimum amount you can do that will achieve you the most feminine result? When I say minimum amount, I don't mean that if you do a change to the forehead that you do a minimum change. You do a maximum change to the forehead, but maybe you only need to do the forehead, and you don't need to do cheeks, nose, lips, chin, jaw, Adam's apple, you know.
Yeah. When I've met, I have, Marianne, you'll be able to help me with this one. I've met some trans people in the past, and they kind of go through the stages of the transition that they would like to achieve, and they've talked about obviously the social transition and then the medical transition. You mentioned hormones a minute ago, Marianne, and then they talk about and it kind of feels like, all right, my next step is surgery, and I want to have this done, and I want to have this done, and I want to have some facial feminization. And personally, I look at them and I'm thinking, I don't see why you need that. And I'm just wondering, you know, for me, the steps that they've already taken, in my eyes, says feminine to me. Do you know what I mean? And I'm thinking, are some people just on that road because they just feel it's the next step that has to be done, if you know what I mean? And it goes a bit like your shopping list, Alex, you know, when you're talking about the brow and the nose and the chin and the throat, you know, it's, and I feel a bit sad really that we need that someone to step back and go, hang on a minute, you know, you don't have to have all of these things done. I don't know, Marianne, whether you get to talk to people in that situation or...
I mean, I think the hardest part of my job sometimes is talking to somebody where they think this surgery will make me female.
Yeah.
That actually, I worry that, we can do all the surgery, but, you know, there's something about self-acceptance. However, I think, and I'm sure Alex will know more than I do about this, I obsessed about facial surgery for a long, long time. That I just went on, the first time I spoke to my GP was because I felt addicted to looking at outcomes. And the irony is I've never had any so far. But I suppose the real point is that we can't understand the depth of dysphoria that people are feeling around certain areas of their physique. And I think for some, certainly men, people that were assigned male at birth, that have had real damage done by testosterone, this is a real genuine need. I think sometimes there are some people, they just believe that if I have this surgery, this is what's needed to be seen for who I am. Some people, it genuinely is a need because...
this is something that varies. There are almost as many different cases as there are different patients. I mean, you know, nobody needs facial feminization surgery to be valid. You know, nobody even needs a transition to be valid. You know, that you don't need any medical interventions. If you know, I'm a strong believer that a trans woman is not a man who wants to be a woman. It's a woman who was assigned male at birth. You know, there's nothing you have to do in order to be valid. However, there are a couple of things. There are two elements to if we're thinking about passing. So I know that's quite a loaded word as well. But the thing is, there's how you are perceived by other people. Okay, so if you are perceived by other people as a man, even though you're a woman, that can be very distressing and upsetting. And sometimes the perception people have is based on the structure of your face. And in that case, FFS can sometimes help, although it's limited. And if your passability problems are to do with other things than your face, it may not make a huge difference. But there's also our relationship with our own reflection. So how we pass to ourselves. And that's where things start to get a little bit more complicated, because I see many people who have no problem passing when they're out in the general public. They have the option of living stealth. Nobody knows. But they know that little bump here above their eyebrows is something that happened because of testosterone. And every time they see it, it makes them feel sad. And So, either they can come to terms with that and just say, well, it doesn't really make any difference in the end. It's just one of a few lingering things about the puberty I went through. Or they can say, well, look, I can get rid of that and feel better about myself. It's difficult. It's difficult because this is where you get into the world of body dysmorphic disorder, which is hugely common in trans women, and I've been through it myself. I still fight against it because you have to work out the difference between recognizing a masculinity that happened because of testosterone and seeing what the logical options are to dealing with that, either accepting it or surgically removing it, or an irrational hatred of that masculinity that far exceeds the effect that it actually has in any objective sense. That I'm trying to explain it on my website. I was using probably quite unfairly Jennifer Aniston, who is an extremely beautiful actress, but she has quite a square chin. Okay, now this has no effect on her. Nobody mistakes her for a man. But the reason I use her as an example is that if she came to me and said, "Do you know what? Is my chin masculine?" And I could say, "Well, technically, it's a little more towards the masculine range than the feminine range on average." And she said, "And could I feminize it?" And I'd say, "Yes, you could round it off if you wanted to." So that's kind of a reasonable approach. That maybe she just doesn't like it, and people should be able to do what they like with themselves. However, if she came to me and said, I can't go out, I won't leave the house because of my chin, I always talk with my hand over my chin so people can't see it, I won't let anybody take a photograph of me because I hate it so much. Well, then when you look at her reaction and set it against how she actually looks, that's where you start to see there's such a disparity between those two things that there's probably a psychological problem here. And the problem with that is that you can't fix that surgically, because you are looking at, because the problem's in your brain, so you're looking at your face through that brain, so that even when you round that chin, you're still looking at your face with that same brain that's going, I hate it, I hate it, I hate it, I hate it. And you can get into that. It is always a terrible example to use, but the Michael Jackson thing, where if you look at him when he was excuse me, when he's a young man, he has so he's black, so he's got a broader nose than a European, but he had quite a broad nose for a black man, and he was bullied about it. And so he could come to you and say, "Could I get my nose narrowed a little bit?" And you say, "Sure, why not? Go for it." And if you look at some of the earlier pictures after he first did it, it looks fine. It looks fine. But then if he looks at it and thinks, "No, it's still too wide, I want it narrower," so surgeon narrows it again. And he says, "No, it's still too wide," and narrows it again. "No, it's still too wide." And it keeps getting smaller and smaller and smaller. And it's because he can only see it as a wide nose. This is a psychological issue. And it's trying. Sometimes it's a difficult area. It's a difficult area because you don't want to be recommending surgery to people for whom it's not going to make the key difference.
Yeah.
Managing expectation, I think, is probably key. That why do they want it? What, a bit like you said with the architect. Why do you want a red door? Just working through it with them. I suppose ultimately, and this might be probably one of the challenging parts of your job, is when somebody comes to you that is obviously beautiful or feminine already, and they're going to want to make changes that are going to be potentially, I won't say not making them beautiful, but it's not going to add any value to their appearance or life. Well, emotional well-being, I suppose.
A very key thing is to differentiate between beauty and femininity.
Yeah.
beauty is subjective. It's always subjective, and it's entirely subjective. It changes throughout time and according to culture. So, for example, I like very old movies. I like watching 20s and 30s movies. I was watching a Jean Harlow film the other day. I don't know if you know who Jean Harlow is, but she was a huge sex symbol in the early 1930s. But by today's standards, nobody would really consider her beautiful at all. But she was an absolute pin-up then. Or you can look at, you start going back through paintings of people who were considered very beautiful, and you think, really? It's kind of a surprise. But and of course, different people's taste varies. Personally, I like faces with a bit of character. If somebody has something odd about their face, I automatically find it more attractive than somebody who has a perfect face, which can be quite dull, quite bland. But femininity is objective. You can measure it. It's a biological fact. There are objective differences between male faces on average and female faces on average. So you can essentially measure that. I mean, you can't. It's difficult to measure it in kind of millimeters or things like that. But you can say that there are these differences, and they're objective. So it's very important to differentiate between the two of them, because they are constantly conflated. There are a lot of surgeons out there who sell beautification procedures as feminization procedures, and that's not what they are. So there's another one of the ways they start totting up things on the list. And so yeah, I'm always at great pains to explain the difference. So if the example you came as somebody who's very beautiful, so you can be very beautiful and have some facial masculinities. Or you can be have an entirely feminine face, but not be particularly attractive. These are quite different, different things. So, but one interesting thing is I have found time and time again, it's one of the most reliable rules in FFS, is that the more beautiful and the more feminine the person is that you speak to, the more insecure they will be about their face. And the most problematic conversations, the most difficult conversations, are usually with the people who others would say need surgery the least. So I do meet those people who perhaps transitioned in their teens, maybe even with puberty blockers, so they have very little observable masculinity, but who literally will not leave the house. And constantly got their hair right over their faces, wear sunglasses, and trying to hide all the time. And there is this just lovely face behind it. It's a very difficult area.
It is. It's those. There's so many aspects to a human person. This is not about gender alone. That human person has a gender. They have a brain, a very powerful brain, and what that image gives to them in the mirror, as you say. And then they have their body and their structure, as well as their brain and their gender and their hopes and their expectations. It's very difficult, isn't it, for many people, whatever gender. For help me educate myself, and hopefully that will help other people also have that education. What is it that testosterone does to a face if it's allowed kind of unimpeded during puberty? And actually, as I've learned more recently, not just during puberty, it's that carries on, doesn't it, in the 20s and 30s, that masculinizing effect of testosterone, well, which is what it was designed to do, I guess. But yeah, what exactly, at a kind of very basic ground root level, what does testosterone do to someone's face, to their body?
When an archaeologist digs up children's skeletons, they usually struggle to tell whether they are male or female. There's nothing obvious in the skeleton to give that away. You can sometimes work things out, but most of the time they're very, very indeterminate. What happens at puberty is that the female skull essentially stays the same. You get bigger, but the overall structure stays the same. But the male skull changes a great deal. how do we start? If you go from top to bottom, okay, so let's go with hairline height, right? Now, there's a common misconception that men have higher hairlines in the middle than women do, and in fact, it's the opposite. Men have slightly lower hairlines in the middle.
I can see what you're doing, but just for the listeners, what do you mean by hairline height?
Oh, right. Okay. So imagine drawing a line from the top of your nose to the straight up to where your hairline starts. Okay. That distance is typically longer in females than it is in males. Okay. But most surgeons and most patients think it's the opposite.
Yeah, I would have done, yeah.
Problem with that is that because they think it's the opposite, surgeons typically do a procedure called a scalp advance, where they cut all along the hairline and move the whole scalp forwards. Now, the problem with that is it leaves you with a visible scar all along your hairline. And it brings your hair actually further into masculine ranges than feminine ranges. So for the vast majority of the people I work with, they actually don't need to lower the hairline at all. Right? But the key difference between male and female hairlines is the corners of the hairline. So if you think of it this way, a male hairline is typically M-shaped, like a capital M, whereas a female hairline is typically U-shaped, like an upside-down U. Yeah. So you have these corners to the hairline, and these are one of the things that develops at puberty. So one of the things I discovered through my research is that when you add corners to a hairline, it makes the whole hairline look higher. And I think that's one of the reasons people think that masculine hairlines are higher in the middle. So it's kind of an optical illusion caused by the corners of the hairline. So typically in FFS, what you do is you fill in the corners to give the hairline a more rounded shape. It's best done with transplants. Then you avoid any of these scarring issues. Okay, so that's the hairline. Then you get to the brow bossing. Now, this is the most important area in facial gender recognition. Brow bossing refers to a kind of a ridge of bone that stretches right across the forehead at about eyebrow level. And in males, this is typically much more strongly developed than in females. And because when we talk to people, we look at their eyes. The eyes are the single most important thing in a person's face, and this is the frame of the eyes. So it's one of the reasons why it's so important. So yeah, you get this heavier, much heavier bone above the eyes in males. So removing that is probably the key procedure in FFS. There are also other things. There's things called frontal eminences, which are like kind of bumps in the middle of the forehead, and there are things called temporal ridges, which are kind of ridges that go up the sides of the forehead, and these all tend to be more strongly developed in males than females. But these can all be smoothed down as part of the FFS. And then you get to noses, and there's less difference between male and female noses on average than people realise, but the key differences are that if you look at a nose from the side, the angle at the base of the nose is more upwards on a female face and more kind of coming out at a right angle on a male face, typically. The male nose tends to be a little bit bigger, and you often have a bit more of a hump to the bridge. And then you get to the cheeks. And this is another area where people are making an awful lot of mistakes, because there's this idea that men have much stronger cheekbones than women do. Now, when you look at skulls, you can make the argument that the cheekbones are stronger in males, but when you look at a face from the outside, you can't see that. This is all hidden underneath the soft tissues. And the key difference between male and female cheeks is that female cheeks have an awful lot of fat in them. This is something that is the hormones, generally estrogen, will fill the cheeks with fat. And the younger you start hormones, the greater the effect. But there's a lot of variation from person to person. So the cheeks get fatter, and then you've got the distance between the top lip and the nose. It typically grows longer at puberty in males, So usually when a woman's mouth is open and relaxed, you can see her upper teeth. But quite often when a man's mouth is open and relaxed, you can't see his upper teeth. There's a procedure to shorten that distance. And then, as I mentioned, going down to the chin, as I mentioned before, the male chin tends to be vertically taller, wider, and has more of a square shape, whereas the female chin tends to be shorter, narrower, and has more of a rounded shape. And then the jaw, people often think that men have much wider jaws than females. Actually, in proportion to the faces, this is not really true. What they tend to have is vertically taller jaws. So a lot of people want their jaws narrowed when really what they need is the height of them reduced. Uh-huh. And then you get down to the Adam's apple, of course, where everybody has an Adam's apple. You can't, it's a vital structure. But what males typically have is a sort of a bump on top of it, made of cartilage, which can be smoothed down. So all these things tend to happen at puberty. There's this concept called neoteny, which is when a childish characteristic is retained in adulthood. And this is essentially what a typical female face, adult female face is like. It's like the face they had when they were young. It didn't really change at puberty. So there's this fundamental principle in FFS, which few surgeons follow, but which I think is absolutely key, which I call puberty reset. And it's the idea that the purpose of FFS is not to give you a new face, to make you look like somebody else or some idea of femininity, but to take your face back closer to its original construction before the puberty happened. So it's giving you your own face back before the effects of testosterone happened. That should be the fundamental principle of FFS. Sometimes people misunderstand and they look for pictures of beautiful women that they particularly find attractive, and they say, can you make me look like this? Can I be made to look like this? Can I have a nose like Beyonce? Can I have eyebrows like so-and-so? And it just doesn't work like that at all. And trying to do that to a face, it typically leads to disaster. You just can't do it. But what you can often do is reverse, at least to some extent, these effects of testosterone at puberty. So it's your face. You look like you, and you being you is the very purpose of transition, after all.
Yeah, that's the difference, isn't it, between feminization and beautification? And we have to be very clear, don't we, that they are very different.
Yeah. Absolutely.
Marianne, you look like you were going to ask something, and
What's been going through my mind here is the education I'm getting listening to you. Because one of the things I struggle with sometimes, because, and we talk about it at GenderGP a lot, the language around what we're doing and what the points of the exercise are. And it's forever evolving. And sometimes we'll have a meeting, one of us will just go, stop, we've just got to stop saying that. It doesn't feel right. And just listening to you talk then, and some of the stuff you said to us today, just makes me realise that, in the therapy room or when people come to GenderGP, for whatever help, it's reminding them, or not reminding them, us using the right language so they get a better understanding of what they're really saying. Does that make sense? They're not falling into a narrative of what other people are saying, that this is about them, and like you say, going back to their original face.
Yeah.
Going back to Jennifer Aniston's face or Beyonce's face.
Yeah. Yeah, that makes sense. The language is always... it's always difficult. I mean, it's one of the things making me quite nervous right now, because I know I'm talking very fast, which is a little bit of an ADHD thing. But I know I'd listen back to it and I'll be thinking to myself, no, you shouldn't have said male there. You should have said masculine. You shouldn't have said, and of course, there's been no mention of non-binary people in this whole conversation of facial feminization. But of course, they are absolutely key and entirely as valid as anybody else.
But I think you're right. I think that's what we're saying, isn't it? Is that this isn't about making you into a woman or making you into a different gender or an in-between gender or neither gender. This is just about taking you taking your face back to what it would have been if you hadn't had testosterone on board through those really important years. So this isn't making you, this isn't validating your gender, this isn't making you a woman, this isn't making you more non-binary than a man. This is just about feminizing your appearance, as it would have been if you had had access to estrogen when you were going through puberty and your 20s and 30s, instead of having testosterone in your body. So, you know, we all, I mean, language, don't worry, we're always slipping up. I am anyway, with language. And, you know, we understand that it's very important, language, but, you know, when we're so passionate about something, sometimes the wrong word slips out. I have a question though. I'm interested because testosterone, of course, works below the neck as well. Yeah. And so, you know, traditionally, the male skeleton is broader, taller, and that reaches right down to hands and feet. So is there sometimes a mismatch? Because it seems to me that we can do feminization of the face, but does that then cause a mismatch with the skeleton below that face? Is that something that we see or not?
I don't think so, because it's one of the interesting things is that I have a concept on my website. I call it the gender scale, and it's like a scale that goes from F5, which is as feminine as you could possibly be structurally, to M5, which is as masculine as you could be structurally, and GN in the middle, which is gender neutral. So there are all these stages. But the thing is, one of the things I discovered many years ago, trying to find an M5 and an F5 face, like a face that is 100% masculine, extremely in every aspect, and the same for a feminine face. And they just don't exist. They just don't exist. And I mean, even things like, you could look at a really hyper feminine face like Marilyn Monroe, and she still had an M-shaped hairline, which is a masculinity. You know, technically it's a masculinity. And again, if she came to me, I would say, no, you don't need to fix it. Sorry, you were saying about the mismatch, so that you have a very feminine face on a very, let's say, masculine body shape. No, I don't think that happens, because I think that happens in real life. I see people, because I obviously am completely obsessed with faces, and I examine people's faces all the time. So I see people who are built like rugby players, massive, you know, big blokes. And I'm looking at them and I'm thinking, do you know what? Your nose, forehead and chin are entirely within feminine ranges. You don't notice it, you know, because there was some huge boxer. I can't remember who it was, and somebody was saying, now that's a masculine face, and I said, well, actually, and I had to explain several things about their face, which was actually quite feminine. So I think it seems it's a very good question, but I don't see that happening in real life. What you do see is things like, for instance, if somebody wants a tiny little turned up nose, but that they have quite an underlying facial structure, some of which you can't fix. Let's imagine they have quite a long face, which is a common problem for trans women. And there's a limited amount you can do about that. But they want this sort of hyper feminine nose, like a tiny little turned up nose. And if you impose a nose like that on a face like that, that can look kind of strange sometimes. It can basically, it looks like a rhinoplasty, and rather than the nose they would naturally have. So that's an area where a juxtaposition can be a little bit jarring. But even then, you can sometimes have somebody with a long face and a little turned up nose. Yeah. So
it's like what you're saying, isn't it? It's really what we should be concentrating on, is giving you your face shape back, kind of pre-testosterone, rather than choosing from a selection of noses which one would look best for you. It's
yeah.
You know, it's making you, feminizing you, isn't it? Not changing you. I think it's absolutely fascinating. Once again, I've learnt so much. I don't know about you, Marianne, but I learn every time we talk to new people, and it's really, really fascinating. We're going to put your website below the podcast so that people can come and have a look at what you do, because I think it's really, and you know, I think what you do really helps people, and it also must be a huge help to surgeons and the doctors who are going to actually carry out the procedures that person is thinking about, and that you're kind of simulating with your Photoshop. I think
that depends a little bit on which surgeon you ask. I've made quite a few enemies, because
I'm sure you have.
One of the key things about what I do is that people often come to me with they've already spoken to several surgeons and they have several very long shopping lists, and I show them that you don't need this, or this. So there are quite a few surgeons who have said some fairly unpleasant things about me in the past. So yeah.
Well, I think we all have our role to play in healthcare, in giving people the information so that they can make their own informed choices, and that's what it's all about. It's been fascinating talking to you today. Thank you so much for sharing your knowledge with us and our listeners. It's been really, really great. Thank you so much.
You're very welcome. Thanks for having me.
Thank you.
Bye.
Bye.
Thank you. We hope you've enjoyed our programme. Do go ahead and subscribe if you haven't done so already. If you or anyone else are affected by any of the topics discussed in our podcast and you'd like to contact us, please drop us a line at doctor@gendergp.co.uk. We're very happy to accept ideas for future episodes and guests, or if there's something specific you'd like us to cover. You can also visit our website, www.gendergp.co.uk. You can follow us on social media @GenderGP, and you can sign up to our monthly newsletter. Full details can be found in the show notes on our podcast page. Thanks for listening.